In LJ University, the Department of Pharmacology, we have a team of 4 members. I am Dr. Ashish Panchal, Professor and Head, Department of Pharmacology.
I am Vijay Kevlani, Assistant Professor, LJ Institute of Pharmacy.
Hello, this is Mansi Shah, Assistant Professor in LJ Institute of Pharmacy.
In pharmacology, pharmacology is one of the core branch of pharmacy which connect with other interdisciplinary subjects such as human anatomy physiology, pathophysiology, clinical pharmacy, pharmacotherapeutics and pharmacy practice. In human anatomy physiology, in this subject the students will able to learn the external and internal structure of the various organ with respect to their size, shape, location of the vital systems of our body. Also, the students learn how these all organ will perform their normal function and how they maintain the homeostasis of our body. In this subject, it's a hierarchy of cell, tissue, organ system and body organization. In the cell, the students learn the basic concept of the cell and their organelles and the structure of tissue, functions, their organization with respect to various organ and organ systems. For an example, like cardiovascular system, endocrine system, human nervous system, reproductive system and many more systems in this chapter.
So, being a health professional, you are expected to diagnose a disease, to prevent a disease and to cure a disease. Now, to do so, you first need to know what a disease is. So, disease means something abnormal or something not working smoothly. So, under pathophysiology, you are going to study what is disease, how disease onsets, how it is progressed and how to treat it. Okay, so the word pathophysiology, that is derived from a Greek word pathos and physiology. So pathos means a disease condition and physiology means normal functioning of body or organ system. So combining these two words, pathophysiology means the branch of science which deals with how disease changes the normal functioning of an organ system. Let's say hypertension. So hypertension, a disease condition, produces some changes in normal functioning of heart. So study of that condition is known as pathophysiology. Under pathophysiology, you are going to study definition of disease, etiology, that is root cause of disease, risk factors of disease, pathology of disease, pathophysiology of disease, morphological condition of disease. Then after, there would be sign and symptoms, diagnosis and complications of disease.
So, pharmacology. What is pharmacology? Pharmacology is the science that explains how drugs and other compounds interact to the biological system, that is, starting from molecule to cell to organ to whole of the body. From aspirin, paracetamol to various other antibiotics, pharmacology is the heart of range of crucial medical discoveries that improved everyday life. For thousands of years, people have known about the toxic and therapeutic effects of certain plants, animals and minerals. So, pharmacology is that branch which explains the better understanding of drugs, its effectiveness, regarding its pharmacological effects, side effects, usage, contraindications and interactions with other drugs and substances. Thus, pharmacology and its related fields are going to be the forefront of future treatment for many diseases.
Pharmacology is everywhere, whether a substance from natural origin or synthetic origin. It is the science that says how medicine works and processed by our body and crucial for discovering new medicines to help find diseases such as AIDS, heart diseases, cancer and infectious diseases. This fundamental course helps to understand that some drugs can be harmful and more likely to be caused by athletes. Thus, through the pharmacology makes unique contribution to today's science and tomorrow's medicine, providing wide allowances to every stage of drug discovery and development. The profession of pharmacy should become more focused on patient-centered care through the provision of medications and advice about the appropriate use of medicines.